Today I'd kind of like to talk about my husband, John Desmarais, and how the medical center at Bowling Green came to be. In April of 1975, he arrived in Bowling Green to start his job as the administrator at Bowling Green Warren County Hospital. He was 33 years old at the time. His previous career was as a salesman for Motorola. During that time, he got to be friends with several hospital administrators, and he really enjoyed learning about what they did. He went to night school, got the additional credits he needed for his undergraduate degree, and got his master's in hospital administration. So right out of school, he went to work at a hospital in Tennessee as an assistant administrator. After about 2 years, he was contacted by a recruiter about this open administrator position in Bowling Green. He really thought he didn't have much of a shot at it, but he decided to go ahead and try. So when he got the offer, he was pleasantly surprised. But with typical New Jersey bravado, he said he would accept the job on the condition that the board would be hands-off day-to-day operations. He knew he needed to move quickly, and he didn't want to have anything stopping him from those kind of decisions. Some folks called City County the poor people's hospital. Employee morale was lousy. He had to win over the medical staff while at the same time helping them understand that it was his job to manage the hospital, not theirs. Early on, he knew that probably the answer to most of the problems would be to build a replacement hospital. John and Carol Sumner went out into the community. They met with any group that would listen. There was a lot of opposition, but he overcame all the objections. And in March 1980, just shy of 5 years after he arrived, the medical center at Bowling Green opened. Recruiting physicians was huge. We had a very limited supply of physicians and very few specialties. I remember he brought the first female OBGYN to Bowling Green. Scottsville was our first acquisition.
Great day for all of us, and hopefully a great day for Allen County.
And then Franklin. That was a major step for those communities. He spotted Connie early on. Something just clicked. He saw something in her. And he had never had a chief operating officer in all those years. And so Connie, he tapped her as his first COO. And then kind of naturally after that, he wanted her to be his successor. After 35 years at the helm of what was by then a much bigger organization, he retired in December 2010 and sadly passed away in August 2012. He was eulogized as a great leader and a visionary who transformed healthcare in South Central Kentucky. I agree with that assessment, but I also think he was a man who truly cared about the people in this region and wanted to ensure they had access to the best possible health care. I think MedCenter Health is his legacy.